Welcome back. Healthcare concerns plague both men and women, of course, but a brand new study from Bankrate shows how much deeper those worries are for females. One key stat, 25% of females who needed healthcare avoided the doctor over cost. The number drops to just 18% for men. Joining us now, Dr. Mikhail Varshavski, also known as Dr. Mike. Good to see you, Dr. Mike.
Good to see you.
Do these numbers surprise you?
They do surprise me because, to me, being a family medicine doctor, I always see men that are scared to go see the doctor or not go see the doctor. But it looks like when it comes to cost, women are generally going to be making the decisions when it comes to health care. So right now, with health care costs skyrocketing, even outpacing wages in this country, women are factoring that into their decisions to go see the doctor. And that's bad for someone like me who's trying to keep people healthy from a preventive aspect. I don't want cost to be a prohibiting factor.
Yeah, JP Morgan also did a study recently, and we had her on, the woman who was overseeing the study. I mean, she basically said that they have all this internal data because they see your credit card and what you're spending on your debit card. And she said that right after the tax checks go out and people get their tax return money, that's when the doctor appointment starts increasing. So again, they're waiting until they have the money to go to the doctor, regardless of how they're feeling.
Yeah, and that's not a positive thing to hear from a doctor's standpoint, because a lot of times what we want to do is catch things early before they become a major problem. We don't want to wait to the point where there needs to be an operation done. Things disintegrate. Cancers are best treated early. We want to get ahead of these things.
But by the way, if the entire medical community was more upfront with the cost, if you tell a woman, if you could call and say, I need to make an appointment to have this taken care of, how much is this going to cost me? Here's my insurance. Tell me what it's going to cost me out of pocket. They can't do it. Rather than waiting for some bill to show up, or rather than waiting literally months to get ridiculous.
Why don't they know the price of the MRI then? Why don't they know the price of the CAT scan then?
Right, or even just lab results can run hundreds of dollars. Yeah. And so I don't think this is just good cost-benefit analysis by women who manage the family finances.
Well, and as part of that study, 47% of the women felt that the medical bills were too expensive, more expensive than they thought, versus 35% of men.
Well, to me, that's a surprising statistic as well, because to me, 9 out of 10 of my patients are surprised by their hospital bills, and rightfully so. As Dagan says, we don't know the costs of the MRI, we don't know the costs of the lab tests going in, and here's even a more worrisome statistic. You can go to the emergency room into a hospital that your insurance is considers in-network, but if one of the doctors that's hired by the hospital is not in your network, you can get charged completely different fees. That's crazy. How are you supposed to make a quality decision?
So it's up to the doctor?
Can I come up with a solution for everybody?
Yes.
Hi, solution here. Health savings account. It's a tax benefit that you can use. You can start stashing away money in the HSA. Yeah. Talk to your financial advisor. Talk to your bank. Go in. Put your money in there. Yes, health savings account. This is a way to combat what you're talking about.
It's true, but I'm also thinking about it from the healthcare standpoint. Why is there no transparency? Why is there different facility fees between hospitals?
Totally.
Why if I go get a vaccination in a hospital as opposed to in a family medicine doctor's office, the fees are completely different?
Yeah, there's even an early check-in fee.
Can somebody just answer the question, why?
Why? Because hospitals feel like they need to increase prices to make up for treating patients that don't pay their bills or that are not having insurance supporting them. And if you think about the illegal immigrant population, if they show up in the emergency department, they don't have insurance, but by law, the emergency department has to treat them. So that cost has to be made up somewhere.
To answer your question, it's shady. The way that pricing and billing is handled in this country is shady. And there hasn't been enough of it. Oh, you're talking to Alex Azar coming up.
Yes, we are. We're going to put that question too.
But one other thing, women are less likely to go to the doctor because they're not big babies. Men, again, I said this
Oh, there's that. There's that.
You've got a blister on your foot, and they're telling their wife or their girlfriend, I'm going to get gangrene. And we get sick of hearing about it, so we send you to the doctor.
Go to the doctor.
How about incentivizing good diet and exercise? Have you ever thought about that?
Exactly.
There you go.
Prevention, that's key.
Dr. Mike, thank you.
Thank you.
Great stuff.